Uncensored Conservatism, episode 164, looking at Project 2025. And I swear we're almost done with this. But anyway, chapter 20 of Project 2025 is about the Department of Veterans Affairs and was written by Brooks Tucker, who served in the VA under both Trump and Biden. They note that the VA operates 172 inpatient medical centers that are an average of 60 years old and over 1,100 community-based outpatient clinics. They also contract with Optum and TriWest to build and operate outpatient services outside the VA system. Now, there's 18 million veterans, with a third of them using VA medical benefits and facilities. The problem is that despite a workforce of over 400,000, there's a lack of new enrollees to offset the declining older population of veterans. Obviously, being conservative in Project 2025, all abortion or transgender reassignment nonsense must cease at VA hospitals or clinics. That's not what they're there for. Of that 18 million veterans, half are enrolled in VA healthcare, with 6.4 million of them using it consistently. About half of them are over the age of 65. With veterans living longer, this places the fiscal strain on resources. Community care is key to the dilemma where veterans receive assistance in medical care where the VA is deficient. This guy watered down those efforts by making it harder for veterans to receive referrals to private doctors. At the very least, there should be transparent reporting on patient satisfaction and timeliness of service at VA clinics and hospitals. As for those aging 172 inpatient facilities, some are underutilized and chronically understaffed. Some geographical areas have seen declines in their veteran populations. Project 2025 suggests more investment in the community-based outpatient clinics instead of investment in inpatient facilities. Some facilities only see 6 patients per provider per day, while others see 19 patients per provider per day. Those that see more than 19 patients per provider are actually receiving better care than those at the lower range. Perhaps Saturday appointments should be considered, and veterans offered an option based on appointment availability. Maybe a longer drive to a less utilized facility in a shorter time span should be an option. Getting VA doctors is a problem. Retired physicians should be considered to help in this area. The advantages of telehealth should be explored to speed up the timely deliverance of necessary medical care. The VA should offer tuition assistance to aspiring doctors, provided they offer their services in rural or underserved communities. There's clearly a need for more mental health professionals given the substance abuse and suicide epidemic among veterans. And it goes without saying that no American veteran honorably discharged from the military should suffer homelessness. When it comes to military-associated disabilities, the VA should contract with private companies to administer exams. Increased use of technology to advance veterans' claims is a necessity. And finally, about $500 million is wasted annually on fraud and improper payments of veteran benefits. Although a relatively short chapter, the sometimes ignorant treatment of veterans in this country must be corrected. Mental health has long been overlooked, and facilities have been understaffed. We as a nation owe our veterans more than we have shown in the past. They can no longer be an afterthought. And that's it for today. In this chapter, it was short, sweet, to the point. Have a great day and a more pleasant tomorrow.